Hello, it's Dr. Rhonda Johnson. Today is Friday, September 2nd, 2022. And people have asked me, will I get this new Omicron bivalent COVID-19 booster? And the answer is yes. But I'll share my reasoning, and I want you to know everybody needs to do their own individual risk assessment. Now, here's how I came to my decision. I checked out the information that was available to anyone at the ACIP, the Immunization Committee Advisory Practices of the CDC. They met yesterday, they'll be meeting today, and the information is available online. I highly recommend the PowerPoint that says Evidence to Recommendations Framework, Bivalent COVID-19 Vaccine Booster Doses by Dr. Sarah Oliver. Now, in these presentations, they have presentations from Moderna and Pfizer, but the ACIP acknowledges that there's no clinical trial data for bivalent boosters with BA4, BA5 available to date, no international data yet available for bivalent boosters. They acknowledge that people of racial and ethnic minority groups have been disproportionately burdened by COVID-19 illness, hospitalization, and death. And as of June 2022, people ages 50 years and older who have had greater than 2 boosters have a 14 times lower risk of dying from COVID-19 compared to unvaccinated people, and a 3 times lower risk of dying from COVID-19 than people who have just had 1 booster dose. Now, I looked at the side effect data and the Moderna clinical trial with the Omicron BA1 bivalent booster, which is the data that the ACIP used for this analysis. In the study group, the only reactions, and that's the human clinical trial, are the ones we've seen before: fever, fatigue, chills, arthralgias, headache, lymphadenopathy. In the Pfizer clinical trial for the Omicron BA1 bivalent booster, the side effects were what we've seen before in the ancestral vaccine: fatigue, chills, arthralgia, headache, and mild to moderate lymphadenopathy. The ACIP acknowledges that the risk of myocarditis following these bivalent COVID-19 vaccine booster doses is not known at this time. They did see that the antibody titers from the Omicron BA1 bivalent booster were higher with the bivalent vaccine compared to the monovalent ancestral vaccine. And they projected that broad uptake of the COVID-19 vaccine boosters early this fall could prevent more than 100,000 hospitalizations compared to later or a more limited rollout. So that's how I made my decision, folks. I'll let you know when I get my vaccine. I've shared this information publicly with every shot that I have received. So I hope that's in full transparency. I always base my decisions on the available evidence that I can learn and a risk analysis of what's best for me given my health factors. Of course, I will talk to my doctor at my next appointment, which is coming up. So I hope that's helpful for those who have been asking me. And as always, be safe, be well, and have a great day.